I am honored to be here today to address problems in which we are all aware in a more effective manner. A special thank you to the amazing project director. Together, we are not only tackling simple problems, but breaking down their complex root causes and how we can best tackle those with the resources that we have and the resources we know that we can grow to implement. We will begin by defining these problems. Currently, Staten Island, New York is facing a problem of addressing substance abuse, not only at a young age, but also in workplace settings. This deadly, unfortunate, and very real murderous problem can be tackled and addressed through data and evidence-based strategy. A second and deadly problem that Staten Island, New York is also currently facing includes lack of community health education and access to public health care, such as public hospitals. Objectively, evidence supports that there is an obvious divide between the north side and south side of Staten Island, yet as a whole, it is reflected that Staten Island, New York holds the highest all-cause mortality rate for New York. This includes accidental poisoning and overdose. Evidence has exposed the obvious reality of prescription and illegal and illicit drug abuse in Staten Island needing to be addressed urgently. It is our ultimate goal as an organization to divorce records of high mortality rates effectively. Solutions to implement in this community are based off of who has the most effective and best access to these groups. What solution has the best chance of actually being successful, not only in the short term, but in the long term to benefit the health of all in the community. These solutions not only provide life-altering education, starting at the 5th grade level to be ingrained throughout an individual's schooling and to also reach their peers and family through that system of education, but it also provides a consistent reward and consequence system, which is further implemented into by employers. This will provide much needed and organized and consistent collection of data that will shed light on what further needs to be established in policies and in organizations on multiple levels. Substance abuse is a complex beast and it needs to be addressed in an accurate, complex light. The health impact period is one of many tools that need to be used for accurate evaluation. All right, we have reached criteria. It is vital to cease under-addressing backbone organization resources. This includes financial funding responsibilities. A great mistake to avoid moving forward is underestimating our stakeholders, underutilizing vital stakeholders, and ignoring funding resources that can greatly benefit implemented strategy. Moving forward, the citizens of Staten Island will benefit best from the collective impact 5 conditions if they are maximized. They are currently being met at a minimum as they are, by definition, a minimum. Do not treat them as a minimum. Exceed the 5 conditions. There is an amazing opportunity to lead Staten Island, New York towards equal and greater health. In order to do that, a lot of revising needs to take place. That includes down to the documentation level. There needs to be some rewarding of requirements, and there needs to be some revising of standards moving forward, not only for the steering committee, but for work groups. Meetings are to occur more frequently to address obstacles and problems that have been holding the organization back from making life-changing decisions. The morbidity rate is not going to change by us being less productive. We need to be more productive with a more structured agenda, and this will involve us becoming more educated on how to use our own resources, such as video conferencing tools and social media. The data needs to be broken down in a more honest way. The data has been here but neglected, and we need to start exposing it for what it is in order to create meaningful solutions that will actually have the most impact. The final criteria is going to be so transformative and amazing. The final criteria involves health literacy in the community. I made sure to email everyone ahead of time, and I can also email after this PDF provided by the CDC. This whole presentation, I hope, has been not only eye-opening, but personally educational for your own health plans. This slide reviews that patients with low health literacy are less likely to take preventative measures and therefore end up in an emergency room due to neglecting those signs and symptoms as they were not previously educated that they were red flags. They're going to have more hospital stays, they're going to be discouraged to see a doctor, and what we're ultimately avoiding, they're going to have high mortality rates, which is why we're all here today. High mortality rates that we need to get lower, we need to divorce. And again, do not be discouraged by this data. This data is guiding us towards developing needed solutions. Let this data be a motivator to help the people of Staten Island and form as a compass or sense of direction that will allow us to no longer have the high all-cause mortality rate of New York. We can change this drastically through health literacy in the community. Again, these solutions and criteria and problems to solve are going to take time and resources and people, consistent education and consistency of implementation. But it is important to understand what is causing our citizens to be in hospitals in the first place and what is causing our citizens to avoid healthcare in the first place. Chasing all of these will help us fairly and systematically address and tackle why substance abuse is claiming so many lives. Implementation of health literacy has many beneficial health effects. And there is a multitude of accessible, easy, and economically friendly ways to implement health literacy for both the North and South shores of Staten Island. We tackled a lot today, a lot of meaningful, necessary topics today. I hope that it has motivated and inspired you. These statistics are disturbing, but the good news is we have a lot of dedicated individuals who want to solve these problems, who need to solve these problems. All of this information is available to you through your email. Please follow up if you have any questions.